Hey there, it's Cody Garrett for Taxes and Retirement, Wednesday Night Live. Andy Panko, who's in that awesome video in the beginning, is not here tonight. I think he's at a concert right now, having fun with his daughter, I believe. So we're gonna have some fun with health coverage, health care before Medicare, pre-age 65 today. So I'm gonna wait for it. There we go. David Foltz is in the chat. There we go. Good to see everybody here. I see that there's 15 so far. So I'm actually going to get started. I only got one joke today. I'm a little lacking on jokes, so maybe you can type in if you got any jokes in the chat related to health insurance. Since we're talking about health insurance today, before Medicare, my joke is this right here. So my health insurance company refused to pay my bill because I believe in reincarnation. They said I had a pre-existing condition. I hope you guys like that one. Maybe here, let me get the laughing child. So that person who believes in reincarnation has a pre-existing condition, but pre-existing conditions don't have to be the end of the possibility of getting healthcare. Now that we have the ACA, also called Obamacare, also called the exchange, we'll be talking about a lot today. Hello, Facebook user in New York. That makes me want sausages, Sodger teas. Awesome. Well, let's get started. Let's go right in so we can have an early evening. So I've got this little thing here. Let's see if it shows up. All right. Somebody comment and say whether or not you can see this on your screen. Health coverage before Medicare. Randy from Florida. Good to see you, Randy. Hey, Mary. So excited. They're all here. 50-something people listening to me talk about healthcare. This is crazy. So I'm going to go ahead and get started. So I recently, thank you so much for letting me know it shows up. So I recently presented something. Actually, I'll go ahead and go to the front slide here. I presented this Inside Experts Planning for FIRE, Financial Independence Retire Early, for the XY Planning Network. I was considered an expert for an hour, which was fun. So I wanted to take really the second half of this presentation and show you really how I discussed with other financial planners how I think about healthcare before Medicare. So I'll go ahead and jump to that part. So beyond the question, do I have enough money to retire? The most common question and concern among retirees before age 65 is, how will I be able to afford health insurance? Right? So something was fascinating to me. I specifically do financial planning for early retirees before age 59 and a half. But one piece of data like blew my mind and made me realize that this is a bigger concern than just for early retirees or people who plan to retire before 59 and a half. The Employee Benefit Research Institute, they reported that 70% of Americans retire before they're eligible for Medicare. So this shows that really everybody should be planning for health coverage before Medicare, whether you actually plan to retire early or not. So if you're on here and saying, oh, well, like I'm not going to retire before 65 or I'm over 65, like this is still a good opportunity to learn and share what you're learning with other people as well. And if you don't plan to retire until 65, sometimes people end up retiring sooner than later due to all sorts of circumstances in terms of being laid off, things like COVID, where a lot of people lost their job and didn't end up going back to work and ended up just kind of being forced into early retirement. So health coverage before Medicare is a major concern, especially for families who are about to pull the trigger. And as we know, healthcare can become very expensive very quickly. So there's 7 options for healthcare before Medicare, and I'm just going to quickly go down these 7, and then I'm going to show you how I specifically research the healthcare exchange when I'm looking for insurance for myself and for families. So I actually have my healthcare through the healthcare exchange, and I'll show you how I found even coverage for myself along the way. But using an example of somebody who's closer to that traditional retirement age. So the first method for coverage for before Medicare is it's available through Cobra. So typically up to 18 months after you terminate employment with a group benefit, you can usually have up to 18 months of coverage through Cobra. So a lot of you just finished filing your taxes. So if you still have your form W-2, from your employer if you're still working. If you have your W-2 from last year, you can take that out, and you're going to look in box 12, and there's going to be a code that says DD. So in box 12, it's code DD. It shows the cost of the employer-sponsored coverage, which is the employee portion plus the employer portion combined. So if you take that number in box 12 and multiply it by 102%, 1.02, then that will be a good estimate for how much your Cobra cost will be on an annualized basis. And again, you can typically have Cobra up to 18 months. Typically, if you end up, sometimes it can extend coverage to 36 months, including a spouse. Especially if the reason for moving off of your health plan is because you're going onto Medicare. But just know that 18 months is typically what you're going to. Surprised the ACA is not number 2 on the list. So these aren't prioritized by kind of goodness or which ones are best. But actually, I specifically put the healthcare marketplace, the exchange, last, because that's going to be where I'm going to focus a lot of my time. So again, if you want to kind of estimate what Cobra would cost, you'd look at box 12 of your W-2, code DD, and multiply that by 102%. So the disadvantages of Cobra, well, the advantages of Cobra is you can keep your health care. If you terminate employment in the middle of the year, you can keep you don't have to reset your deductible. And of course, the disadvantage is it's usually more expensive, and also it usually of course, it has that limited duration of usually 18 months. So some employers also offer what's called retiree health coverage. It usually requires the retiree to meet some certain age and number of years of service, and is also complemented typically by a pension plan to which few early retirees have access. I think moving forward, pension plans are certainly going away a lot more since the 1970s. So therefore, a lot of retiree health coverage will go away as well. So you'll notice here, number 1, 2, and 3 on the list, they require some type of coverage through a group plan. Number 2, all right, if one spouse retires, special enrollment may be available through the other spouse's workplace plan. Since this requires one spouse to continue working, it's not quite early retirement for the whole family. Typically, if people are thinking about health coverage before Medicare, it's usually the spouses are retiring either at the same age, or one is already retired previously and is on that workplace plan. So again, if one spouse retires, that can open special enrollment to join the spouse's workplace plan. Number 3 is a part-time job, university enrollment, or professional association. So some early retirees utilize something called Coast FI or Barista FI, which the FI there stands for financial independence, in which they're available. They're really available to work a part-time job to cover some income needs, but with no continued savings needs. So really just getting a job for benefits or for maybe some supplemental income, but really just coasting. They call it Coast FI because you're kind of coasting along until full retirement without any additional savings needs for traditional retirement. So some retirees go back to college and may become eligible for university coverage. Again, it just depends on where you go. I don't know too much about this. I hope the feed's not breaking up. Let me know if something needs to happen here. So some retirees may go back to college or another university, but I don't have too much experience with this, but I've heard that some universities do offer some group coverage ongoing. And there are some professional associations that offer group coverage to its members. But of course, typically a professional association is usually going to make sense for membership while you're working, and also provide other benefits such as group long-term disability insurance as well. So number 4 is health sharing ministries. So these are cooperatives to shoulder the cost of other members' medical expenses, members of the health sharing ministry. So I'm familiar with Samaritan Ministries, for example. Membership usually requires the profession of religious beliefs, church attendance, and abstaining from recreational drug use, whether or not it's legal in your state. One thing about health sharing ministries is that pre-existing conditions apply, and treatment options can be limited. Not just treatment options, but also I have heard kind of horror stories of people kind of getting kicked out of the plan because they were too much of a health liability. I see something here that says health sharing ministries are very risky, more like a GoFundMe. Give them your money and hope they pay something. Oh, I guess I can bring that up on my screen. They are not insurance, so under jurisdiction, but not insurance. Lots of lawsuits and people on the hook for hundreds of thousands of dollars, so no recourse. I have heard some of these fears. Some of them kind of unsubstantiated, but some like are legitimate cases where somebody joins a health sharing ministry. Typically, it's going to be less expensive. That's usually why people join. Also, if they have a religious belief, they might feel like it's a way to kind of invest in things they believe in by joining a health sharing ministry. From what I've seen, it's less expensive, but again, there's pre-existing conditions apply, and those treatment options can be limited. These ministries are not technically defined as insurance, so therefore they cannot be combined with health savings accounts, HSAs. Although the coverage may be less expensive than traditional insurance plans. Number 5 is private health insurance coverage. So you could just contact a local health insurance broker, agent, or insurance company. With private health insurance, medical underwriting and pre-existing conditions do apply. Really, they've got the, what is that called? It just dropped out of my head. Maybe it'll come back to me. But really, they really don't, people with a lot of chronic, critical health conditions are typically going to be turned away or pay substantial fees here for medical underwriting. And also with private insurance, the government-funded premium tax credits, which I'll mention in a little bit, those cannot be applied to these private plans. Number 6 is households with really low income, modified adjusted gross income falling below 100% of the federal poverty level. They're typically not eligible for, they're eligible for the exchange plans, but not eligible for any subsidies in terms of the premium tax credits. But if they're not eligible for subsidy because of their income being too low, that means they're going to become eligible for state-specific Medicaid and CHIP programs, which is the Children's Health Insurance Program. And I'm going to show you an example of how those income levels drive which plans families end up picking. So lastly, and where I'm going to spend most of my time tonight is the public health insurance marketplace, also called the exchange, also called ACA, Affordable Care Act, also called Obamacare. Unfortunately, I don't know if it's completely unfortunate, but really health coverage, the cost of healthcare has really become a politicized debate, especially with, for example, the exchange being called Obamacare, right? But just going away from that a minute, the health insurance marketplace, the exchange, is actually not government insurance. The exchange is really a matchmaker between consumers and consumers. I hear you fine. Thanks, Bruce. So the healthcare marketplace is a matchmaker between consumers and insurers. It's not government insurance. So again, they're just playing like kind of third party, helping people get the coverage, and then also helping with government subsidies. So the health plans cannot deny pre-existing conditions, right? This is huge. This is something that really benefited a lot of people when the exchange, went public. If people are saying, I can finally get insurance at an affordable cost with pre-existing conditions. At the same time, right, that's, it kind of threw a wrench in terms of the actuarial calculation of insurance, that typically people who are at high risk are not able to get insurance. And now this allows anybody to receive health coverage, therefore increasing the cost for others. Kind of, again, before the subsidies come in, this is what a lot of people are saying. First of all, I can't keep my doctor like I thought I would. And also the premiums actually did go up for a lot of households that weren't receiving premium tax credits. So we're talking about there's refundable premium tax credits that are available if household income falls between 100% and 400% the federal poverty level. So that was the case, before this last year. The American Rescue Plan Act of 2021 temporarily expanded eligibility for the premium tax credits by removing that 400% federal poverty level subsidy cliff, as they call it. And that removal of the subsidy cliff could be extended through 2025 with the Build Back Better Act currently under consideration. So again, I'm going to show you examples of how levels of modified adjusted gross income in retirement can provide benefits in terms of the premium tax credits. So these are the typical, these are really like the top 7 health coverage options before Medicare. Some people mentioned to me that they either can like self-fund. I don't really like the word self-insure because really insurance is a transfer of risk. And if you're doing it yourself, you're not really transferring it. So to self-fund your health coverage, some people say, okay, I'm willing to, like, maybe I've got 2 years until 65. I'm willing to, I'm pretty healthy. We don't have any chronic health conditions. Let's just try to make it work for 2 years. If something comes up, maybe we can, maybe the prices won't be as bad. I got a great message earlier today from a member who said she ended up, not doing any traditional health insurance and made it fine, even with some things going on. So, but most families, I would just at least suggest that most families at least get some type of, care for those, really the critical, like really just protecting the worst from happening in terms of not having hundreds of thousands, sometimes millions of dollars worth of health expenses. And that can be satisfied by using something like the exchange to get some type of catastrophic plan, which I'll mention in a little bit and show you the different kind of levels of care and coinsurance on the next slides. So I'm actually going to show you how I look for these exchange plans, like in real time. Before that, I want to show you, like, these are really the steps I take before I go through them with you. So I always start with healthcare.gov/C-plans. So on your screen, you can go ahead and earmark that. So when you go through this, I'm going to show you how I do it in real time, but you'll enter your zip code. So there's 33 states that will, if you're going to retire, or if you're going to be on healthcare, if you're going to get your insurance through 33 different states, you're going to remain on the healthcare.gov website. Here's an example of that list. So you can see that this is the list of the states and areas like, DC, for example, where you start at healthcare.gov/C-plans, but you're going to end up going to the state, the state level exchange, their own separate website. So I'll come back to this. So once you're on healthcare.gov/C-plans, you'll type in your zip code. If you remain on healthcare.gov at that point, you're going to claim your household members and your dependency status of the people in your household. Then you're going to estimate your household income. And the reason that you estimate your household income is to determine, how much subsidy you may or may not receive based on what we talked about, the modified adjusted gross income. You're going to filter plans. You can filter by premium. So that's how much you pay per month and how much the premium tax credits pay the insurer per month. You can sort by deductible, which is the amount that you have to pay before the insurance company starts contributing toward your health expenses. Coinsurance, which is the percentage that you pay, the percentage that you pay versus the percentage that the insurer pays. Those are broken down by metal color. I'm going to show you those in a minute, but you'll see there's platinum, gold, silver, bronze plans. Out-of-pocket maximum. So what's great about the out-of-pocket maximum is you can look at the policy and say, this is literally the most amount of money I'm going to spend on healthcare, just relatively. This is the most amount of money I'm going to spend on healthcare in a single year. And that's where it's really great to create an adequate emergency fund to cover at least the out-of-pocket maximum per person who's insured. And there'll be an individual deductible and a family deductible based on how many people are in your household. You can also sort by insurance company. So some people really like, down here, people say, I really want to stay on Blue Cross Blue Shield because I like the network, or I want to go on Aetna or Ambetter. Again, you can look at the networks, and specifically there, you'll see you can actually type in your medical provider, like your doctor that you like to see. I like to go to Dr. Chen, and you can say, oh, well, Dr. Chen is covered by this insurance, but not this plan. Also, you can filter by HSA eligibility. So to contribute to a health savings account, you have to enroll in what's called a high deductible health plan. And it's not just, so some people look at a plan, they go, that's a really high deductible, right? But that does not, if you see a really high deductible, that doesn't necessarily mean it's a high deductible health plan. And I'm going to show you on healthcare.gov how it specifically tells you if it's an HSA eligible high deductible health plan or not. So again, medical providers, and you can also do a search for your prescription drugs to find out if they're covered through that plan. And lastly, you can compare. You can click different coverages to really compare them side by side, apples to apples. Look at their cost and various income levels. So David Foltz says, what are your thoughts on using an HSA to reduce your modified adjusted gross income to increase premium tax credits? I absolutely love it. Again, if a family is retiring before Medicare, one thing that's really important to point out is, if you contribute to an IRA, a retirement account, you have to have earned income to contribute to an IRA. Different than that, you can contribute to an HSA, a health savings account, without any earned income. So you can, again, you retire. Let's say that I retire at 60. I'm going to have 5 years before Medicare. Let's say that I'm generally healthy. I want a high deductible plan, lower premiums. If I want to lower my modified adjusted gross income, I can contribute. Let's say that I join a family high deductible health plan. I can contribute as a family. This is somebody who's 60 years old. So they can contribute as a family $8,300 to a family HSA. Actually, I'll back up. They can contribute $7,300 to the family HSA without any earned income, or regardless of earned income. Then each spouse who's covered over age 55 can contribute an additional $1,000 catch up. They need to make those catch up in separate accounts. So this is typically, you're going to see $8,300 going into the family HSA, and then an additional $1,000 going into the other spouse's HSA. But yeah, a great point that David makes here is that when you contribute to an HSA, that contribution is actually considered a deduction. It's called an adjustment to income on your tax return. And guess what? It's above your adjusted gross income on the tax return. Therefore, since the premium tax credits are based on your AGI, or modified adjusted gross income, your contribution. So if I contribute $9,300 to an HSA, I've therefore decreased my AGI, or decreased my gross income by that much. Therefore, maybe even squeezing out some additional premium tax credit. So it's a great strategy to use, but only if the high deductible health plan makes sense for you to begin with. So great question, David. So that's kind of like the order of operations for going to healthcare.gov/C plans. And then again, I'll leave this on this page for a minute. These are, again, the states that have their own health exchanges that you'll start at healthcare.gov/C plans. You'll type in your zip code and it'll say, oh, you're in New Mexico. You need to go to this site. So always start at healthcare.gov/C plans, and then it'll send you to where you need to go to compare different plans. I'll actually get back to this. I'm going to go ahead and share my screen. We're actually going to walk through what it's like to review the healthcare plans through the marketplace. So you can ask questions along the way, and I'm going to share a new screen. All right, there we go. I'm going to take my face out for a minute. Maybe, no, that didn't make it any bigger. There we go. I'm going to zoom in here to make this bigger for you guys. I know sometimes it's hard to see, especially if hopefully you're not watching on a phone right now. How about that? That looks good. All right. So this is healthcare.gov/C-plans, like I mentioned before. You simply go here and you type in your zip code to get started. So I'm in good old Pearland, Texas, next to NASA. I'm in 77581. So it's going to show your county. So you'll choose which county you're in. I'm in Brazoria County. So I press continue. So it's going to ask me just a few questions before it shows me the different plans. So don't get ahead of yourself, and don't jump too fast through this, because these are really important parts of the screening process. So I'm going to start here. You can typically skip this if you're not already covered by a marketplace plan. So I'll skip that. So it's going to ask who is in your household. So I'm going to say, okay, well, again, I'm going to pretend that I'm not a 30-year-old. I'm going to retire early. Let's say that I'm 56 and my wife is also 56. So I'm going to say you and other people. I'm going to say, yes, I'm married. Continue. Let's say that we have one child, and let's say that he's 12 years old. So Guess we had him kind of late. So I claim a dependent. I'm going to say yes. I'm going to say that we have one child. Going to continue. So I'm going to say that I'm 56. I'm a male. And you have to go down here. So I'm not eligible for coverage through my employer. I'm a legal guardian, yes, of a child under 19. Yes, I'm not pregnant as the man of the family. I'm not a tobacco user. I gave that up. So I'm going to go ahead and continue. And then I'm going to put for my spouse, 56, female, and also not eligible through any type of coverage through an employer. Also a legal guardian of a child under 19, not pregnant, and not a tobacco user. So then lastly, I'm going to add my 12-year-old. I'm going to say 12-year-old daughter. That'll be fun. Let's name her Penelope. So 12-year-old Penelope is going to be a dependent for us. So no, she doesn't have coverage through a job. She's not working quite yet. She's not a parent, pregnant, hopefully not pregnant, and not a tobacco user. So none of these. So as I move forward, it's going to just say, okay, is this all look good? And you'll say, yep, confirm. So it's also, so here to estimate, it's going to ask you to estimate your income for the coming year that you're covered by the plan. So I'm going to put, I always like to start with like a big number here because I want to see what the cost of the plans are before the subsidies. So I always just like put a really big number here. So I can say like, okay, we're going to make $500,000 in retirement, which again, I'm going to come back to this, but I want to say, let's say I make 500,000 moving forward. It's going to say you are not eligible for premium tax credits because my income is too high to receive that subsidy. So I'm going to go, okay, well, let's see the full price plans. So it's going to kind of show you, going to go through like step by step how you do it. I'm going to show you right here. So first of all, it shows me 156 plans that are available, right? And that's like, it can be completely overwhelming to just start scrolling through literally, over 100 plans. So I always start with filters. So over here, you can add a filter. So I usually don't start with premium because again, like, I'm not really coming in here saying like, oh, well, I want to spend $20,000 on healthcare. Right? I typically want to spend the least amount of money to get the right coverage in the right plan. So I don't really start with, making ranges of premiums, but I will go over here, for example, and say, I want to have continued coverage through a high deductible health plan. So I'm going to say I'm eligible for I want a plan that's eligible for the HSA. And let's just start there. So I can say, okay, that sounds good. I'll apply filters. And what's great about this filtered from 150 plans down to 13. And what's amazing about this list is I don't have to worry now. Every one of these plans is going to allow us as a family to contribute to an HSA. You can see here on the left, eligible for a health savings account. So you'll see when you go across, it's going to say on the top here, it's going to say that the insurance company. So Friday Health Plans. I have that Rebecca Blackstock song stuck in my head. Hopefully that's not the concert that he's going to tonight. Friday. Then there's the name of the plan, Friday Bronze HSA, $0 well visit, $0 vision exam. That sounds like a good deal. So we can see the deductible. So again, you're going to have to pay $14,000 out of pocket before the insurance company pays anything. Outside of just negotiating the cost of your healthcare expenses, they're not going to pay anything until you pay $14,000 as a family. But look, once you pay the $14,000 deductible, that's also your out-of-pocket maximum for healthcare. So once you've paid, including the deductible, including copays, including any of the healthcare expenses for the year, once you pay $14,000 out of pocket, 100% of your future healthcare costs for the year is covered by Friday Health Plans. So again, this is like the cheapest plan actually. It doesn't sound very cheap, right? It's if I do this times 12, that's $15,000 a year before you even go to the doctor, right? So this can, without any premium tax credits, yes, it is a very expensive. It is very expensive to get healthcare. But thankfully, if you have an adequate emergency fund of $14,000 for the year, that means that, hey, we're covered. Like literally the worst that could happen with healthcare, we've got those expenses covered so that the insurance company covers everything on top of that. Plus, so everything on top of $14,000 is covered by the health insurance. So do you have to have an employer's retirement plan to qualify for an HSA? So you do not have to have a retirement. You do not have to have an employer retirement plan. You don't have to have healthcare through your employer. So yeah, HSA is only connected to being covered by a high deductible health plan, regardless of if you're with an employer or if you have any type of retirement plans. So think of the HSA as completely separate from the 401k IRA world and completely separate from a workplace retirement plan or group coverage through an employer. Great question. So the last things here you can see here that these do not cover adult dental or child dental. There are some plans. Again, you can kind of scroll down and find out if those plan features are included. You're welcome. Oh, love it. Andy, in case anyone cares, I care deeply, Andy. Here's my daughter and her friend at the Portugal the Man concert right now. Ooh, I should have played a Portugal the Man song on my keyboard here for you guys tonight. Maybe I'll play something else. But awesome, Andy. Hope you're having fun. It's crazy that he literally logs in at a concert just to check out what's going on. He's just making sure I'm not selling annuities and permanent life insurance to you guys. So Andy, I'm sure will post that picture when he's out of the concert. So going back up here, let's add more filters. Again, you're gonna see these health plan categories: bronze, silver, gold. Sometimes you'll see platinum. So gold is where after you met your deductible, you're only gonna have to pay for 20% of the healthcare cost up to the out-of-pocket max. The other way to see this is that gold means that the insurer pays 80%. Silver, they pay 70, and bronze, they pay 60. So this really has to do with a percentage of the co-insurance percentage that the insurer covers, or you have to pay out of pocket before meeting the out of pocket max. You can also do it by plan types. They keep changing kind of the names of these: PPO, EPO, HMO. I always kind of think in my head, PPO is kind of like you can go anywhere. You use typically like an in-network and out-of-network plans. You can also search again by medical providers and prescription drugs here. I'm going to jump back. Oh, actually, one more thing we need to do is going up here. If you click edit at the top, so now we're going to see, okay, well, how much, let's say that my income is not 500,000. So I just retired. I'm going to have a lot of control over my income moving forward in early retirement before Medicare, before Social Security. Let's say that my income is I'm expecting my income to be $80,000 in my first year of retirement. So I press continue and look at this. So this is an estimate that the premium tax credit is going to cover, $11,400. Can't even say that word. $1,148 per month, which means, with that level of income, the premium tax credit is estimated to be a little bit less than $14,000. So what's amazing about that is I can view plans again. Let's actually go back to where we were, right? Let's go back to adding filters and choosing the HSA. Wow, right? Look at that. So this was $1,200 a month, and now it's $73 a month for my family. But this is a really good reminder that if you have flexibility in your kind of your income sources and expenses in retirement, you can actually manipulate your income, your modified adjusted gross income, to receive the maximum, or substantial premium tax credits for healthcare. I'm going to go back to my slideshow so I can show you an example of what this looks like in real life. Let's see. All right. So this is an example of a chart that I've created. This is actually a real chart that I've created for a household that was going through financial planning. They wanted to retire early with kids, and they were saying, okay, well, how much is the exchange plan? Are those plans going to cost with and without kids, with and without subsidies, depending on how much income we have in early retirement? So the top chart here, hopefully you can see that a little bit. This top chart, you can see that on the left side, coverage. So this is the amount of the percentage of the expenses. Oh, somebody just said, wow, it's so different from where I live in Ohio. Yeah. So, yeah, it's amazing. I looked at the difference between Michigan and Florida, and Florida, it's very expensive coverage, but also a lot of subsidies. So again, all of these prices, you can see at the top of the screen, are based on your zip code. So it really does depend on where you live. So another interesting thing that you just brought up, thank you, Facebook user, is that if you plan on moving in retirement, let's say some people are saying, oh, I want to, I'm a snowbird, or I want to move from New York down to Florida to get to an income tax-free state, state income tax-free state. You could also end up with a lot higher healthcare costs, but maybe some higher subsidies. So yeah, you should always go back and forth. You can see I typically make multiple, depending on there's multiple states in consideration for retirement. So yeah, just focus on the zip code to start off in that kind of order of operations on the website. So the left side, coverage, again, this is the percentage that the employer covers after you meet your deductible. So you meet your deductible, then they're going to cover 60%. And then once you hit that maximum out of pocket at the top here, see if I can actually, you can actually see my mouse up there. Look at that. That's fun. So for example, let's start here at the top. So a Friday health plan, yes, it is HSA eligible. So it's a high deductible health plan. You can see, right, the deductible is pretty high, but it's also, it's defined as a high deductible health plan. So it's HSA eligible. So the deductible is $14,000, which is also the same as the out-of-pocket max. So without dependents, you can see, like just with the two spouses together, it's about $7,000 a year for this plan. With dependents, it's $11,000. So not quite double, but with dependents with two kids, it's about $11,000 a year. So you can see going down. Of course, when you go into the gold plans, the premiums are a lot more expensive. So up to $17,000 in this case. But look at the deductible. Instead of $14,000, it's $5,700. The out-of-pocket max is $11,000 instead of $14,000. So they might spend, if they go to the doctor a lot, right? If they have some chronic health conditions that, again, all of these plans cannot deny pre-existing conditions. So somebody has chronic illnesses or has a lot of expensive prescription drugs, they might end up benefiting from having a gold plan with a low deductible, a lot more higher coinsurance, or I guess lower coinsurance amount, and then a lower out-of-pocket max. So again, you should always prioritize your healthcare in terms of your family's health and what you at least can anticipate in terms of your healthcare costs for the year. So typically, younger, healthier families who don't really go to the doctor except for preventative care, that's where it makes sense typically to have an HSA, high deductible health plan up here with a lower premium, higher deductible, higher out-of-pocket max. So you see, once you go through all this, you go, okay, well, now how will my household income affect how much I really pay? So that's these premiums on the top are how much you'd pay if you receive no premium tax credit. But on the bottom here, this is an example of, okay, if we can manipulate our sources of taxable income, especially having a great balance between, pre-tax retirement accounts, after tax, like taxable brokerage accounts, and then tax-free, Roth IRAs and HSAs. Really, if we have not a perfect balance, but if we have some flexibility of our income and some income tax control, we can really benefit and get some huge subsidies. Like, for example, that top with dependents, that $11,000 plan in terms of premiums, if we had our household income stay at $60,000, that plan is completely free, right? Of course, we'd still have to pay the deductible and out-of-pocket max, but all the premiums are completely subsidized by the premium tax credit. So there's a little bit, some people might assume, okay, well, I just want to keep my income as low as possible to get the maximum annual subsidy. But this is part of the presentation where you have to say, well, it depends, right? So sometimes it could actually make more sense for this household, for example, to, let's say that they have substantial assets in pre-tax traditional retirement accounts, and we're assuming they're retiring at 60, but by the time they turn to age 72, their required minimum distributions, their RMDs, they're expecting their required minimum distributions to exceed their income needs, therefore pushing them into much higher tax brackets in retirement than they were while working or while in early retirement. It could actually make sense. Again, this is like a case-to-case basis that, this family, for example, if they decided, hey, actually, we'd rather reduce our total anticipated lifetime tax liability by converting each year in early retirement, our convert from traditional to Roth up to the top of the, let's say the 22% marginal tax bracket, that's going to be AGI of about 200,000, right? So you can see if they implement that aggressive Roth conversion strategy, it could save them a lot more money in total lifetime taxes than getting literally 5 years of this annual subsidy from premium tax credit. So, if they get the max tax credit, if they get that $13,000 for 5 years, they've saved $66,000 in expenses over those 5 years. But it might make sense actually to not get in any subsidy, convert like literally $200,000 a year to the Roth IRAs within 5 years to reduce their future tax liability from RMDs. Also eliminate some of your Medicare IRMA premiums, which certainly aren't the biggest expense, but we don't want that to wag the dog. But as you can see here, there's a lot of different variables that come into deciding how to control your income. In terms of prioritization, some people say, well, how do you decide? I always prioritize, number one, I prioritize maintaining your desired lifestyle in retirement. Actually, I'll go up higher since my camera goes up high. So the priority is maintaining your desired lifestyle, right? Right next to that is diversification, right? And diversification to me, not only it doesn't just mean making sure all your investments aren't going in the same, same direction at the same speed, but it's also making sure that you have aligned your investments risk and return expectations with when you're going to spend the money, right? So I would definitely prioritize maintaining your desired lifestyle, diversification, meaning I really need to make sure I have stability and liquidity for my short-term expenses so that if the stock market goes down 20%, like the money I'm going to spend at the grocery store next week isn't subject to that volatility, right? So desired lifestyle, your diversification, and then at that point, that's where it makes sense to start doing some strategic things around Roth conversions, realizing substantial capital gains if you have taxable brokerage accounts with a lot of, again, that kind of plays into diversification. If you're overweight, let's say that you have most of your net worth is in one stock, like if you bought Apple stock a long time ago and now it's most of your portfolio is Apple stock or crypto or whatever it is, that's where diversification, we talked about, you're going to prioritize diversification probably over just the tax consequence or the tax opportunity there. So again, desired lifestyle, diversification. Typically, the next one in line is going to be these premium tax credits, whether or not you realize capital gains if they're substantial. IRMA, I think IRMA, which is the Medicare premium adjustments, that's actually one of the things I rarely let wag the dog when I'm making decisions in terms of income, especially I think 9 times out of 10 I've prioritized Roth conversions over IRMA, and also the reason I do that is that it also helps reduce the future of IRMA, especially for if there's a single filer moving forward with the widow's penalty. So a lot of information there. There's a few questions here. What are your thoughts on using Roth IRA money for lower modified adjusted gross income for premium tax credits before beginning Medicare? So it's a great consideration, right? So if you have let's say you just had pre-tax accounts and Roth accounts, you had no cash flow flexibility from taxable brokerage, kind of normal brokerage accounts. Yeah, it could make sense, especially if you have like a large, let's say that right out of retirement, we're in the go-go stage. We're going to go on some Viking cruises. We're going to spend an extra $50,000 this year. It could make sense, right? If, again, you have to think of those other strategies, but it could make sense to take some of that money for that high expense, that high lumpy expense from your Roth IRA, right? Assuming that you've met the distribution rules for earnings and things. Let's say you take $50,000 out of your Roth IRA to cover that trip. That keeps your modified adjusted gross income lower, therefore maybe getting some additional premium tax credits. So again, yeah, that's a great consideration of, I always I think of the Roth IRA as typically the last money to use just because it has the benefit of long-term tax-free growth. But this is one of those opportunities, right? You have to kind of weigh, you have to trade, okay, if I'm going to lose some tax-free growth on this Roth IRA, but it means, the difference between paying $15,000 a year for healthcare or paying nothing for healthcare this year. Again, there's kind of like the sliding rule there. But yeah, taking money out of your Roth IRA in retirement to reduce income for other benefits is definitely worth considering. I started waiting to make IRA contributions until I do my taxes, decide whether it's better to do Roth or traditional. Let's see here. Started waiting. Yeah, so a great point here. IRA contributions can be made until the tax filing date, which this year is April 18th for last year's IRA. So sometimes it's better to wait, especially if you're kind of on that. So one quick thing here is that you can contribute as long as you have earned income as a household. You can contribute to an IRA. There's no income thresholds, like high thresholds for contributions to an IRA. The thresholds only apply to the deductibility of traditional IRA contributions, and then also the ability to contribute to a Roth IRA directly has income thresholds. But yeah, it is sometimes good to wait if you're kind of on the fence, and especially if you're not able to do backdoor Roth IRAs, which Andy's created some awesome videos on YouTube if you want to check that out. How much change should we expect year to year in plan options and cost? Yeah, this is one of those things where I really like to focus on. I always make financial decisions based on what's currently known and currently in my control. So I really don't know the future of healthcare. I think, again, we can all just like make estimations there. But I would just assume, again, you can create buffers in your financial plan. I think that's a great option to say, hey, what happens if I have to spend an extra $20,000? Can I still maintain our desired lifestyle and maintain our portfolio and income sources with an additional $20,000, $50,000? Again, if you're going really rule of thumb here, I think it's best to just say, hey, just assume an extra $25,000 a year in healthcare cost, right? But again, beyond the rules of thumb, I think that I would really, go to healthcare.gov/see plans, figure out what things cost, and at least make the assumption. I just make the assumption that it's going to be the way it is currently, because I'd rather not speculate on either direction, right? I'd rather not speculate that healthcare is going to be free for everybody, and I'd rather not speculate that it's going to be 3 times as much. Because again, if I make plans based on things out of my control, again, I'm kind of moving away from, really there's so much to think about when doing financial planning. So just focus on what you can, the things that you can control and the things that matter. And again, make these decisions on an annual basis based on what's known. That's another reason I don't get too caught up with kind of the future legislation of what may or may not happen. Again, I don't read any of that stuff until they sign the paper. And again, the people signing the paper usually don't know what it means until after they sign it. And that's just one more reason to, again, continue your learning, but don't get caught up in what could happen. Focus on what is happening. So can I use HSA money to pay for future monthly premiums? So only you can use your HSA to pay for Cobra. So only if you're, that 18 months of Cobra, you can pay if you're on unemployment, you can pay for premiums if you're unemployed or on Cobra, and you can use the HSA for Medicare Parts B and Parts D. You cannot use the HSA to pay for Medigap, any Medicare supplement plans. So I think in a way, I'm kind of saying no to your question in terms of if you're not on Cobra, if you're not unemployed, technically unemployed from work and trying to find work, or if you're not on, you can't use your HSA to actually pay these premiums that I'm talking about here. Roth conversion ladders and early retirement that you touched on, the decision to do Roth conversion versus keep modified adjusted gross income low to receive premium tax credits. Question is, are each year's Roth conversions subject to a 5-year holding period before it can be withdrawn tax penalty free? Yeah, so great question here. I've got to create a chart here because I love this topic. So each Roth conversion, the amount that you convert from pre-tax to Roth, each time you convert, each conversion has a 5-year holding period until your 5-year holding period. But once you're 59 and a half, that holding period rule is completely eliminated. So if you're 60 years old and you do a Roth conversion, that part you convert is immediately available without future tax or penalty. There's no more 5-year rule on taxable Roth conversions once you're age 59 and a half. There's a separate 5-year rule for earnings. So that first 5-year rule is on conversions until 59 and a half. For each conversion has a 5-year holding period. future earnings on any Roth IRA earnings that you pull out. Again, earnings come out last. Your original contributions come out, then your conversions come out, then your earnings. Your earnings have a 5-year holding period, but that 5 years is based on the date, the tax year of your first funding of any Roth IRA. So there's a 5-year holding period for conversions before 59 and a half. Then there's a 5-year rule on earnings, but that 5-year rule is only based on the age of your first Roth IRA. So if you started a Roth IRA when you're 50, you do a conversion when you're 60, you're done. Like there's no 5-year holding periods, period, because you're over 59 and a half for the conversion, and your first Roth IRA has been open and funded for over 5 years, tax years. A lot of good stuff. See what else was I going to talk about. I think we might actually settle down from there. Oh, this was my last slide previously. So any questions? Any questions before we head out? And again, this is not an advertisement for my firm. This was just the last slide of this presentation. If you haven't started a Roth IRA account, do it now. So yeah, that's actually a really great tip. So again, you can't contribute to an IRA, a Roth IRA, directly if your income is too high. I think it's around it's over 200,000 married filing jointly right now. But if you haven't started a Roth IRA, there's 2 ways to start it, right? If you're able to contribute and your income's not too high, you can just contribute if you have the earned income to support it as a household. If you can't make a direct contribution, the only other way to start a Roth IRA is you could just do a small Roth conversion, literally just a couple bucks. If you just convert a few bucks from pre-tax to Roth, a traditional IRA to your Roth IRA, just get it funded with a few hundred, $100, a few bucks, whatever. As long as there's probably no minimums on setting up a Roth IRA, but go ahead and get that 5-year clock started. Again, that 5-year clock is for earnings, not related to the conversions. ACA could go away completely if we have a Republican president in 2024. Not sure. I think last time we had a Republican president, the ACA did not go away. I'm actually going to make the assumption, again, based on what we currently know, what's currently in our control. I'm assuming for clients and for anybody who asks that ACA continues until we hear otherwise. But good question. Thank you so much. Good questions. Great job, Cody. Thank you. Can you get dental or vision insurance off the ACA? Yes, you can. Let me screen share this. Lastly, maybe this will be a good place to end. Let's see here. All right, so I'm still here. Let's go back up to. So if I go to add filters, I don't think there's one in here for that. Here, I'm going to add filters, bronze. So typically what's going to happen here, I think there's a separate place for that. But you can also see if you scroll down far enough, there's typically going to be plans that also include dental. Again, they're going to be more expensive because you're adding, actual kind of a plan to it. Let me see. I know there's a lot of pages here. Probably don't want to go through all of it, but yeah. So some of them will include dental, but then there's also, so view health and dental plans. So I'm trying to remember. Here we go. Check this out. View type, dental plans. Love it. So another thing about a vision, if you're thinking about vision plans are, I don't really call them insurance. I call them kind of discount plans. So most vision plans, you're kind of prepaying for your frames and lenses. So I probably wouldn't get, I probably wouldn't, again, just me, even while I'm, on healthcare, I don't get vision coverage just because I see it more as a discount plan. And I got LASIK, which is awesome, by the way, if you haven't gotten LASIK, and you can. And you can use an HSA to pay for LASIK or reimburse LASIK. So again, I'm just going all over the place. But look over here. You can click health plans or you can click dental plans. That's awesome. I didn't know that. So I've actually never used that tool because I keep high level. But that's good to know. Do the state exchanges have similar screens? Yes, they do have similar screens. Yeah, California has like CalMed in there. Again, I'll go back to the back to the original screen. I know we're kind of dropping off here. So yeah, so covered California, is that spelled right? Yeah, that's just a funny word when you look at it. Yeah. So covered California, like they all have very similar exchanges. Thankfully, they're not, at least the ones I've gone to aren't like that convoluted. They're very similar. They probably even had the same guy set up the website. They seem pretty similar on that case, but yes. Yeah, you'll want to see kind of go on to California. And again, they all have their own, they're all going to have their own ways of saying things, but they're all going to look similar. If you're self-employed, can you still take a deduction for the cost of premiums for ACA insurance? Yes. I don't want to go too deep here, but like, so I specifically do. There is a on schedule, I think it's on schedule 1 of the tax return. That's like line 17. I think it's line 17. Yeah, you can, again, I don't want to go too much in giving tax advice here, but yes, self-employed individuals can deduct the cost of health coverage through the ACA. But you know, there's a lot more personal details that go into that answer. At least I deducted it. Hopefully they don't come after me. Any questions before we head out tonight? I'll stop. Here we go. I'll come back to Big Cody. Any other questions? I'm so glad we made time. Oh, wait, I saw this too. Does a 5-year clock start with a Roth 401k as well? Yeah, so the Roth 401k has its own, has a 5-year clock on earnings, but not for conversions. And not necessarily interchangeable, but yeah, if you've met the 5-year clock with a Roth IRA or Roth 401k, I know Andy is like the pro at this part, but like kind of if you're kind of halfway in between, I think there's something about it kind of taking, in a way, taking some of the years. But that's another reason. So, but here's something to keep in mind though, is that the Roth IRA has its own clock. Like it's kind of in a way, regardless of what's happening in your 401k. So yeah, go ahead and get that Roth IRA clock started on your future earnings. I could see pulling contributions with the ladder rule. Yep. I will be doing that as a way to access my Roth IRA money before 59 and a half. If I do a future presentation, let me just show this real fast. I guess you don't really have to give me permission. I'm just going to do it. Put in the chat if you guys would be interested in a future thing about this. So I did a presentation on the early retirement distribution strategies. So the rule of 55, substantially equal periodic payments, and the Roth conversion ladders. If anybody's in the chat who wants to learn more about that, I'll tell Andy that I could do a future presentation on how to take money out. Let me hide myself. And this comment. Oh, how do I take the comment away? Where'd it go? So yeah, I can do another conversation about all the different ways to get money out of a traditional retirement account, 401k, IRA before age 59 and a half without the penalty. Good. Okay. I guess sometimes I assume that everybody in here wants to learn about traditional retirement, but we've got some fire people in here. We've got some, what I call, here it is, financial independent recreational employment people. Thank you, Drake. All right. Well, I'm gonna head out for the evening, but I'm going to see you next time. And I see that everybody's kind of interested in that. So how should I handle? Oh gosh, how should I handle my ESOP to minimize taxes? What if the company's private? So I have done some. I do have some experience with the ESOP employer stock ownership plan, where you actually own a portion of the company and sell it back. And there's diversification rules and all that. I think it's beyond the scope of today's conversation, but maybe Andy and I go ahead and shoot me a DM or Andy a DM about doing one about ESOPs, because I do have experience with ESOPs in terms of diversification and really what your distribution options are. Last thing I'll say on ESOPs is definitely check out your summary plan description for your ESOP. It's called an SPD. Ask your employer, because each employer has a different plan and different distribution and diversification rules for the ESOP. So go check that out. Thank you so much, everybody. I appreciate your kindness and encouragement, and I'll see you next time. We'll see. I'm not sure when next time will be. I'm not sure if I'll keep doing the monthly, but I'll find a way to do the early withdrawal strategies next time you see my face. All right, well, take care. I think David Foltz is actually coming up on a future Get to Know Him call, so excited about that. All right, well, take care, everybody. Thank you. Thank you, Perry.